Hi, my name is Michaela Mattes, and this is my final presentation for the class HORT 521, Horticulture and Human Health and Well-Being, and I will be talking to you about malnutrition. So the topics that I will go over today, or the studies, is older people in Texas, the impact of socio-demographic factors on malnutrition and the other way around, aging and malnutrition, hospital re-entries because of malnutrition, how malnutrition impacted COVID-19 and how COVID-19 impacted malnutrition, older adults and gastrointestinal cancers, malnutrition diagnosis in hospitals, and then I'm going to talk about 3 different screening tools. I will draw a few conclusions, and then you have a couple slides of references. So the first study I wanna talk about is adults 65 and older, and deaths related to malnutrition in Texas. So it was a study after the fact, and they used a 4-year period from 2014 to 2018, and they said that over 25,000 people died of malnutrition in Texas. And what they found was that certain people have a higher risk of malnutrition, namely, they compared the counties between each other, like which counties have a higher risk and which counties have a lower risk. And what they found is that non-metropolitan counties, so where there is not a big metropolitan area, that is a higher risk of people experience a higher risk of malnutrition. Less educated and more impoverished people, of course, people who have low access to food within a 10-mile radius where they live. And then in general, poor rural households have less access to food because in the grocery stores, but also less access to government programs, food pantries, food stamps, and senior food programs. And that directly impacts their nutritional status, and that can lead to malnutrition. On the positive side, I found that people who receive food stamps actually have a lower risk of malnutrition. And adults living in multi-generational households have help from caregivers or family members with meal shopping and preparation. They also have a smaller risk of malnutrition. So for all the people, when you get older, go move in with your kids or grandkids. It is a good idea. The next study I want to talk about is socio-demographic impacts and life stage and taking or not taking dietary supplements. So people, no matter what age, that have a higher risk for malnutrition are women and non-Hispanic blacks. Of course, low-income household members, people without high school diploma, we talked about this earlier, and underweight and obese people. And I think we talked about things like that in class, underweight and over obese people. The highest risk of the people that they studied were people who did not take any dietary supplement. I would assume that they probably don't eat healthy either. Because if you look further, the people on the lowest risk for malnutrition were people taking multivitamin and multi-mineral dietary supplements, and people who ate a diet based on the estimated average requirement. So that's kind of leads back to food as your medicine. The next study is about malnutrition in older adults and how malnutrition impacts older adults. So one thing in this study was found that the decline and age faster. So the epigenetic aging is faster. So they look older than they actually are. The quality of life decreased, and therefore they also experience a higher mortality rate. One thing that I found interesting, that a sign of malnutrition in older adults was poor oral health. So that's a sign you can very easily see, versus looking at somebody as like, do they suffer from malnutrition or not, just looking at them. What they found reasons for malnutrition was, of course, food insecurity, but then also things like poor appetite. Older people sometimes don't have an appetite. Gastrointestinal problems, lack of transportation, like for example, older people not being able to drive, or they take the driver's license away because they're actually a hazard when they drive on the street, which I understand. So that's a big impact. But also not getting rides or having access to public transportation. So that's also a reason why they can't get to the store and get food. Also, medication side effects and social isolation and loneliness. So that goes down to they sit at home all alone. They cannot visit people. They don't have people visiting them. The next study I want to talk about is how malnutrition impacts hospitalization. So there was a study done on an oral neutral supplement with this wonderful name, and it was given to older adults to help malnutrition. And they found that when they got this during the hospital stay, it actually significantly lowers readmission to the hospital. What the same study said too was that Iceland did a study where they have, after the hospital stay, they had a 6 months nutritional therapy intervention, and that also reduced readmission. The next one is malnutrition and COVID. So from class, of course, we learned that if you don't have proper nutrition, you have a harder time fighting diseases like, for example, COVID-19. But this study also did the opposite. They said, how did COVID-19 impact malnutrition, impact the risk of malnutrition? So they said it increased the risk because of social distancing, full and partial lockdowns, quarantine, loss of income, or source of supplemental food such as school meals. So that had made a big impact on having a higher risk on malnutrition. And then of course malnutrition impacts your immune system, and then you get more severe COVID symptoms, like if you had malnutrition before you contracted COVID-19. The next study is about people older than 65 and gastrointestinal cancer. So they said that in general, older adults have a higher incidence of malnutrition, but there were also demographic and geographic distances, which leads to cancer. And yes, so Black or African Americans have the highest rate of gastrointestinal cancers and deaths, and they also have the higher incidence of malnutrition in general, right? Western and Midwestern regions, Alaska and non-metropolitan areas, and we talked about this a little bit earlier, the non-metropolitan areas, they also have higher mortality rates. They not just have less, like they're higher level, a high incidence of malnutrition, but they also have less access to health care and less access to nutritional diverse foods. The next study is about the rate of malnutrition diagnosis in hospitals. So this study looked over a 2-year period where they had like a certain group of hospitals where they had in this group of hospitals had 5 million hospital patients. And they found, when they just looked at malnutrition, how many people were found to suffer from malnutrition, and they said only 4% were diagnosed with being malnourished. And they said it's low because the average in the country, in the US, that's for the US, is 13%. So then they said, so why is there such a low occurrence of being diagnosed with malnutrition. And one of the things is like the diagnosis in itself, what it entails, it takes nutrition screening, nutrition assessment, and then a provider diagnosis. So there's a lot of steps to take before they can be diagnosed. The other reason is for the lack of diagnosis, what they found was insufficient education. So the doctors or the people, the healthcare professionals don't have enough education to recognize malnutrition or to even say, hey, maybe we should look if this person suffers from malnutrition, or it's not part of the standard tests that they run when somebody goes to the hospital. There's several multiple methodologies, so maybe they haven't figured out which one is the best one, or which one they should use, which one gets paid for by the insurance, things of that, lack of awareness. And then they don't have enough dietitians that could help them with the support they need. And the last thing is a system and an institutional culture issue. So the culture, the way I understand, you go to the hospital, they give you pills or whatever, but they don't think of like nutrition as one part of making people healthy. So the last one are the 3 tools to assess malnutrition. One is controlling nutritional status. One is Naples prognostic score, which checks albumin levels, total cholesterol, and inflammatory status. And the third one was a geriatric nutritional risk index. And they found that the NPS was actually better at predicting mild nutrition and then, of course, higher levels of malnutrition. Sorry, mild malnutrition and then higher levels. And as I said earlier, when you have, like, depending on how severe the malnutrition is, it leads to faster epigenetic aging. But the study also said that there were interconnecting factors that accelerated the aging process. One is protein malnutrition. So there's people not eating, or older people not eating enough protein. And then, of course, inflammation in the body. And then, because of the nutrition, changes in hormone production. So the conclusion of my study, or of my looking through all these different studies, was malnutrition costs money to the system by hospital stays and things like that. So it costs money. It ages people faster. It increases the readmission rates to hospitals. Of course, when you have an illness, a virus or bacterial illness, you have more severe symptoms, which means it takes you longer to heal and or longer hospital stays. And hospitals need a better tools to diagnose and make it part of the tools that they use to when they do all these tests, like part of the routine tests. That's what I believe. So things that can lower malnutrition in general, access to food, of course, but also access to SNAP, school lunch, food pantries, government assistance, all this other, all those things. Access to transportation, that was a new one on me, especially for elderly people or people who cannot drive themselves. And then help, when people are elderly and they have a harder time getting around or they have a harder time taking care of themselves, getting things like caregivers or family members that help them with nutrition and buying food and all, things like that. And then social interaction. So that goes beyond nutrition, social interaction. We need social interaction. So here is one slide of my references, and here's the second slide. And thank you. And this is my little puppy Calypso. Thank you for watching, and I hope you enjoyed it. Thank you. Bye.